Hi, this is Brian Wormers, and I'm recording an overview of the course syllabus for NUR 431 Nursing Capstone. This course will take place January 2022 through May 2022. It is worth 3 credits, and it will be predominantly a clinical course, but there will be some posters and papers and assignments along with this. There are multiple instructors as there are multiple sections of this course, and you will be assigned into one of those groups. Course description. The focus of this course is to provide clinical opportunities for the student to grow in professional nursing knowledge and skill. In addition to the expansion of the clinical role, the course will also focus on assessment preparation for NCLEX. So you can look at the credit hour policy here. This is going to be a diverse modality course with some clinicals in it, and you can read and see what that means. Learning objectives will be very important for you in this course, as you will need to write towards some of these in later assignments. But in summation, we want you to demonstrate clinical competencies, incorporating all nursing knowledge from prior coursework. We want you to reflect on professional nursing practice. We want you to apply the nursing process to either a patient or a population. We want you to reflect on the nursing outcomes of the University of Sioux Falls School of Nursing. And you can see that those 8 things are right here. And we want you to review major nursing content areas in preparation for NCLEX. We do have multiple resources here that we want you to utilize throughout this course, especially when we're talking about writing and posters and different things for you to reference. For your evaluation, this will be predominantly a clinical course. With that, we want you to be very independent, but within that scope, we want you to have great communication with your capstone advisor. So, communication in the clinical calendar in a timely manner is going to be important. Communication with your capstone faculty is important. Completing all of your clinical hours, of course, is an important thing. You will need at least 90 hours, and you may not leave early for a shift. So if you hit 90 hours and you're halfway through your clinical shift, finish up that shift, and if you have like 96 hours, you are fine. Your preceptor will need to give you a satisfactory evaluation, so just like regular clinicals that you've done for a period of time, you will need to have satisfaction or above, and then you will need to complete your Castle Branch requirements. There are multiple assignments within Capstone, notably the synthesis paper, the clinical experience poster presentation, and the Capstone final summary paper. There will be additional videos for each of these that will help explain it and help you understand what is expected of you. Later on, we will do extensive NCLEX preparation. So starting in February, there will be weekly ATI Capstone contents for you to complete. You will complete an ATI Comprehensive Predictor exam. You will have a live review, and then you will meet with your faculty advisor. We'll also have reflections for you to complete. This will include clinical or reflections, as well as a student evaluation of Capstone. Grades are according to the following scale. This is the same scale that we've used throughout your nursing program. Expansion evaluation, so communication of clinical calendar in a timely manner. Once again, you are going to be fairly independent with this, but we need you to communicate well to us. So to help do these kind of things, we have to know when you are working, because we are on call as your faculty during that time. And so you need to communicate any changes via email 48 hours prior, and we will have a calendar up that is like a Google document that you can put in the times that you're working. That way we know, because when you're working, we're working. So next thing will be communication with assigned Capstone faculty. On a weekly basis, you should touch in, make some comments on the LMS each week, and then have an update on your clinical progress, reflections, interests, achievements. And of course, if you have a pressing issue, please contact your faculty promptly. We do want you to complete all of your clinical hours, as stated above. These are the times that you're spending with your preceptor. You're going to self-schedule these with your preceptor between January 3rd, 2022 and January 31st, 2022. All shifts must be completed in their entirety, like I stated above, and you may not walk out early on or do half shifts. So, satisfactory evaluation by preceptor, I mentioned that above, but you need to receive at least a satisfactory mark in all areas prior to the end of the course to pass this course. So please see the resource book for the evaluation form. Students are responsible to distribute this form to the preceptor, and then the preceptor will give that to the students, and the students will upload this both for the midpoint and the final. The synthesis paper on the role of the professional nurse. This will be a paper that is meant to provide a holistic overview of your capstone experience, encompassing professional scope and standards of practice. Synthesis means that you're synthesizing using your nursing education thus far, so applying it from multiple different areas and pulling it all together. That's why this is a capstone class. Clinical experience poster presentation. Each student will complete a professional poster representing their clinical case. Poster is a visual synopsis, so basically a snapshot of one of your patients. Each student will then present their case study that appears in a poster presentation that we will host through the School of Nursing. And we want an online version of this also, and so we're going to ask that you go to the One Button Studio in the library to record this. We will cover this in Leadership, Management, and Professional Issues in February. So we will tell you all about the One Button Studio later on. Capstone final summary paper. So each student will write a final summary paper to reflect on the capstone experience as a whole. The student will also reflect on all its expected student outcomes for the School of Nursing and how the student has met those throughout their capstone experience and the nursing program as a whole. There is a rubric for this, so you will see throughout your LMS, if you go into the coursework section, we often have rubrics and handouts for you there. We have not put many items in the resources section in the attempts to streamline this and make it easy to follow. There will be weekly ATI capstone content as stated above. There is a capstone calendar for you to review. This will be based on a weekly type of rotating schedule to cover all the different areas, including med-surg, peds, maternal, mental health, etc., etc. There will be an NCLEX live review, and you are expected to participate in this. This will be an on-campus presentation. There is an ATI comprehensive predictor, so this is a big ATI proctored exam. This will be over a majority of your information is meant to simulate an NCLEX test. So we will use that data. That way we could advise you on what to study and prepare for NCLEX coming up. Clinical reflections. So this will be after each shift. You need to upload those reflections in groups. So if you have clinical shifts 1 through 4, after 4 days, then you upload it. 5 through 8, then you upload it. And if you have more shifts, then you add more, etc., etc. This should be kept on one running document. So for all your shifts, just continue them. When you turn in 1 through 4, that'll be fine. But make sure 1 through 4 and 5 through 8 are on the same paper then. And then you just keep submitting it. This will be submitted on LMS, just like other documents will be. And then at the end, you will have a student evaluation of capstone, gathering, feedback from you and what you thought, what could we do to improve this, or what you really liked about it. Course schedule, of course, this is subject to change, but we do our best to try and get this in a timely manner to you. So dates of the clinical experience is January 3rd of 2022 through January 31st, 2022. Clinical reflections You need to do 1 upload of those after every 4 clinical shifts. Synthesis paper. This paper is due on January 23rd, 2022. There's a poster presentation. It will be due on February 20th, 2022. And then there will be an on-campus presentation, and we will let you know the date of that. There's a final summary paper due on February 20th, 2022. And of course, there's going to be lots of ATI things, and you can see that in your ATI calendar. Policy and procedures, academic honesty. Of course, we want you to be honest, no cheat. And with that, you can read through that. Also, compliance with the American with Disability Act. If this is something that pertains to you, feel free to reach out to us in the Academic Success Center. We're happy to work with you. And then copyright, same as all your other courses. Make sure that you do not infringe on these copyrights. In summation, this was an overview of the course syllabi for Nursing Capstone NUR 431. If you have any questions, please reach out to your clinical faculty, and we'll be happy to answer those. Hope you have a great experience.